Does this work? Oops. It does work. Okay, so welcome everybody to this very exciting panel about psychedelics. So before we start the conversation, I just want to check the room a little bit. How many people have done psychedelics or know somebody who's done psychedelics? See, that
was easy.
Quite a lot, actually.
Wait, well,
these are our friends.
There's
though,
a middle section.
Okay, no, but seriously, this is a very exciting opportunity to have Genevieve and Steve here. And maybe you have a quick introduction also what made you come here to talk about this topic.
Sure. Can you guys hear me? Are these on?
I don't think so.
They're not on.
There we go.
Oh, now they are. Quite loud. And please come in, come sit. We're going to try and make this conversation as exciting as possible. So our connection, yeah, look under your seats. We've brought free samples. No, I'm just kidding. So the way Steve and I got connected to this work was back in 2018, I was listening to a Tim Ferriss podcast about Ibogaine. And for those of you who are not familiar with Ibogaine, it's a very potent psychedelic that's been used for hundreds of years. Its roots are in West Africa, but it's been used successfully to treat opiate addiction. And I had a family member hooked on heroin. Like many Americans, his story is not unique. He broke his neck, got hooked on prescription opiates, and that escalated into a heroin addiction. So I heard about this miraculous medicine and was fortuitously at the same conference as the practitioner a few short weeks later. And I asked him, could you help my family member? And he said, absolutely. Could you help me with this group of Navy SEALs? Those are some of our Special Forces veterans in the United States. I want to help them go to Mexico to get this treatment because it's also really useful for traumatic brain injury, depression, PTSD, the whole gamut. And I said, how could I not help these guys? In our country, these are our bravest and boldest heroes. And I was delighted to get involved. Fast forward the clock. My family member was not able to get access to Ibogaine and died of an overdose in 2020. And when he passed, I was running a startup, and I decided to leave that position to focus full-time on advancing these medicines so that other families could avoid similar tragedies. And thanks to the incredible generosity of my husband, we launched a family foundation focused most exclusively on moonshots and mental health, but have been funding a lot of the pivotal research behind MDMA, Ibogaine, psilocybin, you name it. And here we find ourselves today at a really interesting moment in history. Should I just jump into it or do you want me to pause?
Yeah, maybe just
okay. Or maybe maybe I should let my husband talk.
Oh, mansplain.
You can just, I mean, how did you get into this? How did your interest in psychedelics start?
Sure. It was largely working with Genevieve throughout this time period, and as she mentioned, it's mainly been our philanthropic interests. But at Future Ventures, which I do appreciate the name of the conference, taking our brand and taking it to the future in a positive way. Any case, we invested in a German company, which I would argue is still the leader in psychedelic medicine and therapies with a whole portfolio of different sub-projects across a wide variety of modalities. So I started as an investor. We also started as donors, as you heard, across veterans and special forces as a starting point, but then more broadly, and into academic research. We'll get into that later. But I've seen it firsthand. It helped me quit alcohol abuse. I don't know if I was really an alcoholic, but I drank every night a bottle of wine. That feels like a lot to hold on for decades. And after a single episode of psychedelics, I just gave it up forever. So that was about 6 years ago. These treatment modalities, I would say, are the most efficacious mental health treatments ever to come before regulatory bodies like the FDA. I'll just start with that one statement, and we'll get into it more. There really is nothing like it. It's an absolute renaissance of possibilities, and they're very pan-diagnostic, meaning the same therapy works for scads of different conditions, from eating disorders to anxiety disorders to, of course, depression, PTSD, anxiety, traumatic brain injury, potentially stroke, and neurological diseases as well. So it's a pretty exciting topic, and I'm glad you guys came here to hear about it.
So this conversation is also very interesting because we're entering into a new whole era of healthcare, especially in America, and which is on the verge of changing very much because of a coming government. And Genevieve, you are involved in these activities, and please talk a little bit about this.
Yeah. So we'll have a new president in the United States, if you haven't heard. His name's Donald Trump on Monday. And I can't even believe these words are going to escape my mouth, or I wouldn't have believed them a few years ago. But I think the Trump administration will do more to advance psychedelic therapy and access and healing, and thereby advance mental health than any previous administration. And again, I'm almost shocked hearing myself say this, but there are several folks in the administration, particularly Robert F. Kennedy, RFK, who will be running our Health and Human Services, has personally seen the healing in his own family. He's been public about this, public about his support, particularly for our veterans. So I couldn't be more excited. In a few short weeks, you're going to see some researchers in the United States who have spent decades of their lives studying these medicines who will come into positions of power. And I think we're entering an era unlike any other. And I think the thing I'll add to that and why I think this administration is going to be so exciting is psychedelics address root causes. And that represents kind of a paradigm shift in the way we think about healthcare in this country. So Robert F. Kennedy has been very clear about ending chronic disease. And indeed, Donald Trump has said he wants this to be his legacy, ending chronic disease in our country. And if you take that viewpoint, then you have to recognize that psychedelics are the only tool that actually addresses root causes. And the way we treat mental health in this country today, not this country, but in our country, and I can only imagine Europe's the same, is basically palliating symptoms. So if you're someone who goes to the VA, you're a veteran, your best hope is to just deal with your symptoms for the rest of your life. And in fact, Steve and I remember talking to a therapist at the VA who said, I grow old with my patients. Can you imagine how depressing that is as a practitioner who came into medicine to try to help others, to say, there's basically nothing I can do, but maybe these pills will help. Take these 10 pills. And that's kind of the state of the art in our country, and psychedelics change all that.
So, I mean, since already, like you pointed out, since a couple of years, there are big investments happening in psychedelics, and investors start to be interested in this more and more. So how do you think this will play out in the next couple of years now that there's a legal opening to this, maybe even on a global level?
Right. So obviously we started with the philanthropic angle, and we'll spend more time on that later. But the business side is also quite exciting. One of the reasons is it takes quite a bit of money to get a drug through clinical trials, right? By some estimates, $1 billion with a 10% success rate in general. That's not for the faint of heart. That's hard for most nonprofits to fund. If you look back over time, MAPS has spent 35 years trying to get their product to market as a nonprofit. Then they spun up a for-profit. They had some hiccups. We can get into that later if you'd like. But the capacity to raise that amount of capital, hundreds of millions of dollars, several $100 million, tends to be in the for-profit sector. Now, there are some drawbacks, of course. You want to make a return on invested capital, so you need to have something that's proprietary, be it a patent, a formulation, a manufacturing technology, something. And so there are pluses and minuses for the for-profit model, but let me paint the picture of why it's an interesting business opportunity. First is market size. So we are in a mental health crisis globally. It's insane, and it's getting worse dramatically. Ever since COVID and the isolation, the incidence of depression, suicidality, and what have you has gone up through the roof, right? We've had 22x as many veteran deaths by suicide than by combat this century, right? It's everywhere. In fact, the World Health Organization estimates that if we don't have a dramatic sea change in how we treat mental health, which I would say psychedelics is the only thing on the table that would be that sea change, if we don't have it, we will have the largest disease burden globally by 2030 will be mental health diseases. And it'll cost the global economy $16 trillion a year. Mind-blowing. So then you might say, well, what is business as usual, right? The SSRIs, as Genevieve mentioned, are not effective in the vast majority of cases. They're prescribed to a large number of people, but it takes on average about 7 years of effort to cure about 33% of the people. In fact, the mental health profession never uses the word cure because their numbers would look so bad, they just don't even want to reference it that way. They actually have a institutional aversion to using the word, I cured somebody, right? Again, it's like lifetime of managing symptoms. And the drug companies like the idea that you'll be on an SSRI for the rest of your life. So we'll talk about psychedelics and what they can do in a moment. I'll leave that out, but to say the business case is, it's a huge market, it's a huge unmet need. You have disruptive new entrants, right? Because often big pharma companies, due to the stigma associated with the war on drugs and its sort of marketing negativity, the fact that these drugs are illegal, that's a slight negative to the proposition of how one brings in the market. And the fact that they generally never lead any new change means that this is one reason why, as venture capitalists, about 5 years ago, we're investing in this sector quite actively. And I think about half of all mental health treatments before the FDA today are psychedelic. So it is percolating. It just takes years to come to market. So 5 years from now, we'll see the seeds that are being sown today.
So Genevieve, you're on the board of this PSFC, like the biggest philanthropic organization in America, donating money for psychedelic research, for kind of projects. So what is the biggest challenge to change the narrative for you? Because there are quite some names involved in the foundation, and but still it is kind of a really big challenge to tell people how these substances actually work.
Yeah, there is still so much stigma. So actually, thank you for even elevating this conversation at conferences like this. This might not have happened 5 years ago. So the stigma related to this field is so debilitating. It keeps top-tier foundations from investing in the space, and we're desperate for philanthropic capital. It keeps great investors from engaging in the field, and I'd say the largest problem is that in our country, these substances are Schedule I, which means they meet no medical need and there's high abuse potential. Yet, ironically, LSD, MDMA, psilocybin have all been designated by our FDA as breakthrough therapies, which means they get fast-tracked through our FDA because they are so efficacious and people are so hopeful. So one of the things we've been pushing on is if a compound... Oh, sorry.
And they have no addiction risk.
Not all of them.
The ones you mentioned. Yep.
In any event, so we're hopeful that we could remove these substances from Schedule I, because that's probably the thing that keeps extraordinary entrepreneurs from entering the field and extraordinary foundations from engaging, and it just seems, frankly, silly. The other thing is, I think this is a movement unlike any other. We often look at the gay marriage movement to see what did they do when they were trying to change minds and hearts. And a survey came out recently that basically said if you yourself or someone you love has had a psychedelic experience, you feel very differently about these compounds. So helping people become familiar, whether it's through television or film or PR that we might be doing, or just educating people through conferences like this, I think goes a long way. I also think we need to be really balanced in the communications. So recently, psychedelics have been in the news, and 99% of it has been positive. And then this summer, we saw a flip when MDMA did not make it through the FDA process, and now the stories have more of a negative tone. And I think when Big Pharma starts to realize that we're going to cannibalize some of their sales, we're going to have even more competition or more headwinds. So I would say it's important that we be balanced in our messaging. These are not miracle substances. You still have to do the hard work. I also think they come with some risk. These are potent tools, so you don't want to do them without proper set and setting and the care of someone who knows what they're doing. So I think one of the projects we're about to tackle is an initiative to educate young people who have mental health diagnoses on harm reduction. Because what we found is people who are trying to heal themselves from depression, that's where things can go awry. So we're going to launch a campaign that's targeting youth in California, and we'll see what the outcomes here. And if it works, we'll expand that effort.
So, I mean, we were talking a little bit about it before. So, I mean, we obviously need also new kind of ways to judge these substances and, let's say, drugs so far, for example, as opposed to alcohol. So, and I feel like in terms of the governmental changes all over the world, it's not so easy anymore to say those people are progressive, those people are not progressive. So how do you kind of try to work around, let's say you're in the foundation, your psychedelic communication to people who would say, well, but this is dealing with conservatives, this is not what we like. And then we talked about this too, that Rick Doblin, one of the most famous kind of activists in the field, said, well, this thing, meaning psychedelics going mainstream, will only work if we have a so-called bipartisan approach, meaning conservative people, let's say veterans, will say, we want this, and let's say more progressive people, more tech people, for example, will say, yeah, we also want this. So how can we make this really strong that we have a bipartisan approach to this? This is something I really think about a lot recently.
Do you want to take this?
Okay, I'll kick it off and you jump in here. Or why don't you kick it off?
Well, I'll just mention one thing, then you can say substance. We actually, interestingly, and I'm not sure if this is what your question implied as your assumption, that it is much easier to win over conservative/Republicans in America than it is Democratic leaders. And it's not because they come with more prior experience with these substances, quite the opposite. It's that they don't fear the negative paintbrush of being called a hippie. or some sort of, someone who's drunk the Kool-Aid, if you will. And so from a go-to-market strategy on the marketing, from the philanthropic side, we found veterans are the secret method, right? They win over both bipartisan sides of the aisle in terms of support. They're in desperate need of solutions. The nonprofits that we first funded were in this area, and the meetings we've had on Capitol Hill have been much easier to set up and get follow through on the Republican side. This is everything from the former governor of Texas, who was very Republican, and is very passionate about this field and wants to lead new initiatives in Texas, as well as members of Congress. But
yeah. Yeah, from day one, or at least when we entered the field, it was really clear that this needed to be a bipartisan effort because we didn't want this to get politicized. And I think we've done a good job with that. So Steve and I have gone to Washington, D.C. several times lobbying for this work, as have many other extraordinary people, including some sitting in this audience. And we focused on Republicans specifically because it's easier to sell a Democrat, I think, on the idea of this. But Republicans have been the leaders of this work. I think of someone like Rick Perry, the extremely right-wing governor of Texas, who has now said it is his life's mission to bring forth Ibogaine for everyone who could benefit from it. Like, wow, who would have thought that? So for me, it's incredibly heartening to see that there are few topics in America that bring both sides of the aisle together, and this is one of them. And I think, like anyone, I could ask you about your families, and I'm sure everyone in this room has someone who has struggled with depression, who has lost a life in their family due to addiction. Like, it impacts every single family, so it's not shocking to me that we should be working together to find new solutions.
So in what way do you think, let's say the big topic here is apparently also AI, so in what way do you think AI could contribute or support kind of a destigmatization or like a rejudgment of these information also that we know? Because the storytelling or the narrative around drugs is still, especially in Europe, I feel still very strong. The old one, like the criminalized storytelling.
Actually, I'm pausing for a moment because I thought you were going to ask a slightly different question about AI and psychedelics in general, but I haven't thought about it from a messaging point of view, and that's quite interesting if we could infiltrate Grok and ChatGPT to promulgate. But I'm just free thinking out loud. The place where I think AI is going to have a big impact in psychedelics is going to be in the therapeutic and diagnostic modalities. So what's already happening on the diagnostic side is that you can do fundamental research on what's going on in the brain, right? And it's a very complex organ, and in general, AI is, in a sense, to biology what the telescope is to astronomy. It's a better tool for understanding complex systems and interrelations. So there's fascinating work going on in the field around the mechanism of action in relaxing the extracellular matrix in the brain that promote metacognition and metaplasticity. And a variety of other things where AI helps the researchers. Okay, that's step one. Step two, AI can be helpful on a case-by-case basis in diagnostics. What's going on in there that makes some patients not responsive? So even though the response rate, which we haven't even got to, the efficacy, we should talk about the efficacy of these treatments, but let's just take as a placeholder somewhere between 70 and 90% cure rates for most of what the DSM-5, which is the Psychiatric Manual of Diseases, across all of these conditions. Well, what about the ones who are non-responsive, right? The 20% here, the 30% there. With brain imaging study, guided by AI, people have already shown that they can, in a variety of mental health treatments, in a sense, personalize the treatments. I get most excited about the post-treatment modalities, which are first, an ongoing passive diagnostic for your mental health condition to tell if you're starting to relapse, right? So these things may not be curative forever. Maybe you go 5 years and you're starting to really slip. There's a variety of ways with a phone app that's completely passive that an AI can detect the speed at which you're typing, the cadence of your gait to deduce, oh, it looks like a depressive episode might be coming on before it comes on. And there's a lot of work going on here, and it's quite remarkable. The big idea, in my opinion, is digital therapy, meaning solving the scalability barrier of therapists themselves. So one of the problems with the current treatment modalities is they're very expensive. And they're expensive because they have one, sometimes two therapists in the room for 1 to 3 sessions. Take MAPS, 3 sessions, 2 therapists, different genders, expensive,
what
right?
was the
Many
price
hours.
point on that? Maybe like $80,000 or something? Yeah,
Right.
the bulk is therapy, a couple grand for the drug.
Exactly. So that's not going to scale globally, right? And we're funding projects in the Ukraine and Israel and elsewhere. We're trying to bring these treatments to people everywhere in the world. What if the therapy could be done better by an AI? without the stigma of revealing your inner secrets and traumas to a person who is in your community. If you're in a small town, your therapist might be someone in your small town.
Yeah, but also
right?
there was this recent study that said like 92% of people lie to their therapist. I'm one of them. So, I mean, I would not, I mean, if I would lie to an AI thing, that thing would say, well, you're lying. Okay, yeah, you're right.
And you have
So,
less of an
for
incentive
example,
to, right? You could lower your defenses. It would remember you over many episodes of interaction. And frankly, it will do better than a human because AIs are superhuman in every endeavor we put them towards. And there are some who say, well, what about the emotional, bedside manner of nursing? Yeah, absolutely. If you feel you need to connect, let's say in an end-of-life context with someone who understands your pain. But for the actual understanding of empathy, it turns out the AIs do a better job.
I also just think that as it relates to addiction, there's just so much shame involved, and engaging with an AI and being brutally honest with your AI feels like a little less daunting of a thing, I suspect.
And how does this play out in the foundation? Are there more projects coming that work with AI, that imply an AI?
Most of that ends up being in the for-profit domain, and we try to not cross over at all. And in fact, we haven't been investing at all in psychedelics, anything commercial, so that we can work in Washington and that people know, like, we really don't have a horse in this race. We just want to get these compounds out as safely as possible.
So, I mean, how do you guys imagine, let's say, or what would be your preferred outcome in the next years? How this could play out, like, the change in a legal context, like, how could it look like in a new healthcare system?
Do you want to start?
Yeah. So our North Star, which we share with the Psychedelic Science Funders Collaborative, which is a group of philanthropists who are all trying to move forward this work, is access to psychedelics to all who can benefit. But that means safely, equitably, affordably. So that's our North Star. In the next year, my moonshot is to get MDMA across the finish line. I think this compound, this is the drug known on the street as ecstasy. I think this compound can be so incredibly healing for families, for veterans, for individuals with eating disorders, PTSD, depression. It turns out it's useful for a lot of things. And unlike many of the other psychedelics, it's very gentle, or it usually is very gentle. So I think it can be a kind of an easier entry point for people who might be scared of the experience. So with our new FDA commissioner, our new head of Health and Human Services, who seem to be supportive of these root cause treatments, I'm hopeful that we might be able to turbo-track this additional phase 3 that's being asked of the drug developer right now. So that's my North Star. I also think I'd love to see a lot more funding from our federal government to research these compounds, and I think you'll see a shift in the coming year on that too. No.
It's a good point. NIH funding was very hard to come by. In fact, only starting to squeak open for research projects. And I think there's been a virtuous cycle of the credibility that comes from almost being FDA approved. If it's FDA approved, that'll be a major step change in a sense, the air cover that academics can get everywhere to submit grants, to do research, and fundamentally push the ball forward in a number of different domains. So couples therapy, group therapy, there's so much research to be done still. And so it's very exciting times. I would describe it as a renaissance in mental health. And I think FDA approval of anything would be a major step in that direction, be it psilocybin or MDMA, or the two contenders for which would come first. Mm-hmm. Yep.
So, and how could people in Europe also, what would be your wish that to support this? I mean, let's say renaissance that apparently will be faster in the United States also because of the governmental change now. So what would be the most important points that Europe should deliver to or like the rest of the world to turn it, I mean, Australia already has done it, to turn it into a more global movement, because we will need this on several, continents, I would say.
You want to go first? Or no?
No, I'm unprepared for that. So I would hope that there'd be some willingness to lead, right? So just you mentioned Australia. There's an existence proof happening every weekend in London about MDMA use. A few million kids are taking it every weekend. If you had addiction, people on the street, if you had adverse events, you would know about it, right? You have 8,000, is it now in Oregon?
Yeah.
8,000 people treated with psilocybin, which is more than all clinical trials for all psychedelic substances ever combined. And that's in the first year of regulated access in Oregon. Colorado's about to come online. These are a couple states that are taking leadership. So just like perhaps a European state within the EU could take some leadership to say, it seems pretty clear the cost-benefit analysis might lean towards liberalism here. perhaps we could relax a bit this war on drugs, which was initially founded just for political reasons, to marginalize two very specific groups within America. Nixon launches a war on drugs, admits later they knew they were lying about the drugs, yet we have the scourge of this 50-year, in a sense, ban on research and setting back the field. We could start to undo that. These substances, as Genevieve mentioned, were put on Schedule I in America for no good reason. No medical use? Clearly not the case. Addiction risk? Very low, much lower than tobacco, alcohol, and a bunch of other stuff. I mean, over-the-counter drugs all the time, right? So I don't know what it takes. Where I'm ignorant is I have no idea what that means in terms of how you get that done in Europe. But any one country could say we want to lead in trying to make a difference.
And I think the Netherlands has been leading, and I see we're out of time, so I'll go quick. But I'd say if you're a philanthropist or you have the means to give back, you should consider funding trials here in Europe. Your regulatory bodies tend to be a fast follower of our FDA, so I'm hopeful they'll be following fast after FDA in the United States. But I'd also say speak to your political leaders. This is something that you should be funding here in Europe. You have extraordinary scientists, especially at, we work with amazing people at Imperial College, and there are so many extraordinary universities here who could be doing the work. But I'll tell you, the stigma is even stronger. So the smartest people at your best universities don't want to do this work until they know it's safe. And it is this audience, it's people who, in positions of power who can make it safer.
Amazing. We were right on time. Thank you guys for being here. It was really cool.
Thank you.
To have you.